Botswana has been fortunate to receive various amounts of aid funds over the years, and this year it was expecting $54 million from the government of the United States of America to support programs in the health sector, notably funding for direct service delivery and technical support in HIV and AIDS prevention and care programs. In the wake of U.S. aid funding freeze, the Vice President met with this delegation to discuss challenges and identify the significant and immediate impact resulting in reduction of primary healthcare services for prevention of spread of HIV and AIDS, as well as to map the way forward.
We are under budgeted with that much, especially hard hitting for the civil society organizations, like I've said. But then also, if you look at that and you compare with what we spent as a government on that, we spent just about 9 billion pula on healthcare as a country per annum. So yes, it matters. It is quite a bit of something. By and large, Botswana is still able to quite a huge impact in terms of employment. Because we affected over 1,200 people by and large they're directly employed gets on these civil society organizations.
So in the HIV AIDS sector, immediately what we see is a reduction, significant reduction of outreach to populations who are at risk of catching HIV, particularly you could say from the sex workers, from young girls, adolescent girls, and also the LGBTQI community. So there are a number of people who are extremely vulnerable, and they are sometimes falling outside of the regular health system. So those are people who are being served often in parallel with government by civil society organizations or NGOs. So we're going to turn this crisis into an opportunity to just get much better at what we do, to make sure we continue serving the people of Botswana.
However, the Minister of Health assures Botswana that all is not lost.
There's been a lot of wastage in the sector. There's better coordination and planning such that
we need to ensure that there is better planning and coordination so that different services and support coming into Botswana are utilized properly to prevent wastage.
Because proper planning and coordination, we try to feel at the end of the day, really more streamlined and achieve the same for less.
Mr. Wokedize reiterated that government remain resolute to provide quality healthcare services to all its citizenry, and currently consultative meetings between stakeholders are ongoing with set timelines to fill in the noticeable gaps.